Hello, everyone, and welcome back to this episode of The World's Okayest Physical Therapist, hosted by me, Dr. H. Now, please don't forget to like, comment, subscribe, share, leave a review, leave a rating to help this podcast grow. Again, this is my understanding, my exploration of the American healthcare system from the point of view of a physical therapist, and then sharing that knowledge with you all so that way you guys can better navigate it. Because after all, that's why I'm here. That's why I'm doing this podcast. It's my way of trying to help educate everyone in order to help them determine who they should see and for what. Um, so that's why I'm asking you guys to like, share, comment, all things, because it really helps with the algorithm, and of course, it helps expose people to more, helps expose them to knowledge that they definitely need in order to better navigate this system that we call the American healthcare system, even though it's very labyrinthine. So, without further ado, let's get into the difference between physical therapy and massage therapy. So, a doctor of physical therapy is someone who usually has their doctorate. They've done the 4 years in undergraduate. They've done the 3 to 3.5 years of graduate studies. That usually means they've done 3 to 4 clinical rotations in different settings. They've taken a national exam and passed it, and they take a state level exam and passed it. So now they are not only nationally licensed, they are also licensed in the state. Um, they have an understanding of the biopsychosocial model, which is the biological, the psychological, and the social components that could be impacting a person's functional fitness and movement and things. What that really just means is, from the biology standpoint, okay, what your muscles? Let's take a look at your muscles, your bones, your joints, your neurology. Let's see if all that's playing a role in whatever movement impairment that or pain that you're having that you're presenting with to the physical therapist, or is there a psychological component? And while that is outside of the field of the physical therapist to address psychological concerns, it is the physical therapist's job to say, hey, I think something psychological is going on here. Let's get you referred to a psychologist. And there's the social component, which is, do you have work responsibilities? Are you a caregiver? All those sorts of things, and how that might impact whatever is going on with your movement impairment while you're trying to get back to whatever level of fitness or what have you. So along those lines, physical therapy really focuses on like biomechanics, some neurology, and sometimes like a little bit of an understanding of pediatrics, for example, pelvic health, just anatomy and stuff. And the job of a physical therapist is to evaluate the patient for strength deficits, neurological deficits, balance deficits, things like that, and to diagnose a movement disorder and then create treatment plans in order to help address those limitations that are discovered. And that's why you find physical therapists treating injuries, doing post-operative rehab, helping people with chronic conditions that we talked about a little bit in the last episode, and then, of course, tackling any sort of mobility impairments that impact daily living. Massage therapists, by contrast, these are people that have completed an accredited massage therapy program and passed a licensing exam. They also have to meet state-specific requirements. Now, this usually means they require a minimum number of hours between 500 to 1,000 is what I found online. This also includes coursework in anatomy, physiology, kinesiology, and of course, like massage therapy techniques, which is what they're doing, and then recognizing pathology. So they're looking to say, hey, this doesn't look like something massage therapy should even touch. You need to go and talk to a doctor. And then also ethics, because ethics is a big thing for both physical therapy and massage therapy, making sure you're treating your patients with respect and making sure they're comfortable and they're not feeling that, you're working on them in a way that makes them feel uncomfortable, and only working in areas where they want you to work. It is quite literally a touchy subject. So what they do, they being the massage therapist, is they use hands-on manual techniques in order to relieve muscular tension. That's how I understand it. And this is a focus on like stress relief, circulation, and muscular relaxation. But what a massage therapist will not do is diagnose or prescribe um, anything, right? So they won't diagnose you as having a movement disorder. So if you come into a physical therapy clinic and I assess you, and I'm like, wow, you have decreased shoulder range of motion and decreased strength in that same shoulder, I'm thinking you have probably shoulder impingement, right? A massage therapist is that is outside their realm. That's outside their scope. They might say, hey, you have some muscle tightness, and it looks like your shoulder doesn't move that as well as the other one, but they cannot diagnose you, and they cannot prescribe you exercises in order to help with any restrictions that they see. That is beyond their scope. They are there in order to help relieve muscular tension using their hands or using manual techniques to go in there and try and improve your muscle tension, to release trigger points and improve your stress and to improve your circulation and to encourage muscular relaxation. Now, here's where it gets a little bit hard to explain. Because just like with the chiropractors that we talked about a few episodes ago, where they do adjustments and physical therapy does not do adjustments, physical therapy does manipulations, but to a patient, they might perceive those as the same thing, but they're not. Massage therapy and physical therapy have a somewhat similar relationship. Massage therapy is going in there to massage the muscles, right, to make them feel better. Physical therapists do manual therapy. Manual therapy's goal is to restore function and reduce myofascial tightness in order to improve function. That would be specifically range of motion. So when I'm going in there with my hands working on a tight muscle or providing passive range of motion, that would be me moving a limb for a patient, I am intending to improve their range of motion. I'm trying to decrease their pain and improve their strength and their range of motion. That's my goal. I'm not doing it because I just want them to feel good. I'm doing it with a specific end goal in mind. And what you'll see with this is really, really important, so I'm sorry if this is really dry and boring. A physical therapist will usually take some sort of measurement prior to doing manual therapy. In this case, let's stick with the shoulder. Let's say that the person is limited reaching overhead. So the physical therapist is going to measure how many degrees limited that patient is in reaching overhead. Then they're going to lay them on their back. They're going to go in, release a bunch of myofascial tightness using whatever method they want to use. Passive range of motion, going after trigger points, whatever. Then they're going to sit them back up and re-measure that and say, look, I improved your passive range of, or your active range of motion or your passive range of motion. I improved something by doing that. You now have the ability to reach higher or reach without as much pain or whatever. That's physical therapy's intent. Massage therapy's intent is to relieve stress, tension, and discomfort. So you can see how it's very different. One is I measure before, I treat you, I measure after. The other is I'm just here to make you feel better. Right? So for physical therapy, there's an evaluation, a diagnosis, a known impairment or limitation that you're trying to address, and you're trying to rectify, and you're measuring whether you're able to do that, and you're reporting in your documentation whether you're able to do that or not. For massage therapy, there's no diagnosis. You're just going in there with your hands, and you're kind of saying, okay, does it feel tight here? It does feel tight here. Oh, okay, you're telling me it feels tight over here. I'm going to work on this. The tools that physical therapy use is a whole bunch. So, falling under manual therapy, right, you have tools that you can use like Graston tools. You have specific tools that help you save your fingers and your thumbs, because honestly, this is one of the things that physical therapists can get burned out really, really quick on. Is a lot of people want to treat them like massage therapists, and they just want to come in and get, quote, the massage, end quote. And what this does is you have to understand when your physical therapist is doing this for you, they're basically wearing out their hands. They're sacrificing their hands long term. They're upping their risk for carpal tunnel. They're upping their risk for arthritis. They're upping their risk for a whole bunch of wear and tear. They're doing that with the expectation pretty much that by the time that they're 50 or 60, their hands are going to be shot. So when you ask for that, quote, good old massage therapy, end quote, You have to understand that if the physical therapist is indulging you, they're sacrificing effectively their hand health to help you in a lot of cases. That's why a lot of physical therapists that are well along in their career, they don't like manual therapy because it hurts their hands a lot. And that's why they try to get into other things such as dry needling, Graston tools, or using other tools instead of their thumbs and their fingers, because a lot of physical therapists have hand issues later on in life. So just keep in mind, it's after you do it for 8 hours or 9 hours or 12 hours straight a day that every single patient that comes in wants you to work on them, your hands are kind of done for the whole day. So if you're disappointed when you go into physical therapy and your physical therapist doesn't do manual, just understand that part of the reason why is they're probably trying to save their hands for the rest of their life. Now, for massage therapy, they also have some tools that they can use, but they primarily are the hands-on soft tissue manipulation. The goal of physical therapy is to improve your long-term function. So you might be coming in and they do manual therapy every single time in physical therapy for 10 to 15 minutes. And they're really trying to improve that range of motion. They're measuring every time saying, hey, last session we got you to 120 degrees. This session, let's try and get you to 140 degrees. Wow, we got you to 140 degrees. Look, it's working. Physical therapy is thinking long-term. And they want to improve your overall function. Massage therapy is looking for more short-term relaxation and pain relief. Insurance is covered, insurance. Physical therapy is covered by insurance. Massage therapy, I'm not sure if all insurances. I think the vast majority of insurances probably don't cover that. I imagine that's mostly private pay. So, a really good quote here is massage gets the muscles relaxed, PT gets the muscles retrained. Really good point there. You're using manual therapy as a physical therapist to retrain that muscle, to get it to its proper length and to help improve its proper function. So the question now is, when would you choose physical therapy or massage therapy? Well, physical therapy, as we've talked about for quite a lot, is really good for injury, surgery, or a chronic condition. If you've lost range of motion or strength and you know that you're not able to do something the same way that you did before, we call that an impairment. If you need, if you know that you need you're slipping sort of into this pattern where you're getting close to injuring yourself because of how you do things, that's another good reason to go and see physical therapy. And also, if you know that you're going to be in this for the long term and you want either injury prevention or to rehabilitate yourself, as I already said. Now, when would you choose massage therapy? Well, if you're dealing with just kind of general muscle tightness, lots of stress, and some discomfort, and if you need short-term relief, either after a big trip or event, or if you're looking just to enhance your wellness and relaxation, those are really good times to go and see massage therapy. Now, here's another caveat, right? I've talked about before. Is there a problem if you're seeing one before you see the other, right? Just like with the chiropractor and the physical therapist. No, of course not. Having a patient that goes and sees massage therapy right after physical therapy, they typically go, oh my goodness, the massage was the greatest thing ever. But all they're doing as a patient is setting themselves up for even more success, right? I'm trying to demonstrably prove to them that my massage or my manual therapy is improving their range of motion. Then when they go to their massage therapist just kind of, after they see them, after they worked out, they did their interventions, now they're just going there and helping promoting relaxation and rest, and then they're increasing blood flow. That's amazing, right? I wish every single patient could go and get massage therapy after physical therapy. They've earned it. I put them through the ringer. So massage is, again, really good at circulation and helping reduce stress and relieve stress. PT is better for that strengthening, improving function. So if you're going to do one or the other, I probably wouldn't do massage therapy first and then come see physical therapy. I'd probably see physical therapy first and do massage therapy after. And even then, I'd probably do them on different days. Some clinics, and this is a quick point I want to touch on, some clinics that are becoming more and more cash-based, meaning they don't do insurance, you just walk in, you pay whatever hourly rate it is. They have they happen to have both. There's several clinics that I know that have a physical therapist, nutritionist, personal trainer, massage therapist, um, and an acupuncturist all under the same roof. And what you do is you pay one flat rate per hour, and you can go and see all of them, and they can all talk to each other and say, hey, here's this person, here's what they have, here's what I did with them, and then they can hand you off to that next person. So that's one of the reasons why I'm going to do a podcast on this in the future, why I think cash base is going to be one of the things that kind of wins out in the future, because of the flexibility they have to kind of talk as a group under the same roof with all these different healthcare providers in the same setting and say, we're a team now treating this person. So yeah, some clinics even have both massage therapy and physical therapy under the same building or under the same roof. And so, as always, I like to give a little bit of an example. So today I'll use an example of a patient who, let's say, has left hip pain. And they've been coming in for a while, and I've been doing really aggressive manual therapy, doing trigger point release, really digging my fingers and my elbows in there and trying to release these points of tension. And this patient also has an incredibly stressful job. So every single time they come in, they have retightened up. They have new trigger points presenting. I've worked on them with their stretches. I've worked on them with their home exercise program. And while the knots are getting fewer and fewer and the muscle tension slowly getting better and better, they just keep complaining of tightness everywhere else and a little bit of discomfort everywhere else, and they just feel like they need a good old-fashioned massage. I, as a physical therapist, cannot do that, right? I am stuck to the region, to the body region that is limited, which would be the left hip. I could even maybe hop over to the right hip if I think the right hip is impacting the left hip. But I can't just go and give this patient manual therapy across their entire back and neck. That's just not happening. That's well beyond the region that I'm supposed to be treating. So I'm going to stick to the left hip. And I do my manual therapy all on that left hip. And maybe if I think something from the right hip, some sort of myofascial tightness or weakness or pain on the right hip is impacting the left hip, I might hop on over there and take a look at it and see what's going on. But again, I'm going to focus on the left hip. So I'm doing the trigger point release, opening up. Well, after we work out, I have them do their 45-minute treatment session. We go really, really hard. They say, man, I'm absolutely gassed. I think I'm going to go next door and get massage therapy because I just think my whole body needs just some massage. I am not going to be like, oh, no, absolutely not. Don't go over there. I'll be like, oh, okay, well, you can go ahead and try that and you can see how it feels. Maybe it will give you some relief that you need. And then the patient goes next door after they did the treatment session. Now they're getting massage therapy and they come back the next week and they say, oh my gosh, my back feels amazing. My neck feels amazing. My hip feels a little bit better. What that's doing for me as a physical therapist, as a massage therapist, is just taking other things off the patient's mind, right? So instead of this whole body being flared up, the massage therapist has just helped me narrow down on that patient's hip. And with everything else feeling a little bit better, the patient feels a little bit more buy-in. Now, again, in this setting, I've already evaluated her. I've already determined this patient's limitations in terms of range of motion and strength on this left hip, and I've been treating that, and I happen to use manual therapy to improve her range of motion. When she goes to massage therapy, the massage therapist just works on whatever region the patient wants. So if she said it's my back and my hips, that massage therapist is going to do the back and the hips, right? The massage therapist is not going to evaluate and assess the patient's range of motion or strength. They're just going to go and say, okay, well, let's see where it feels tight. Let's see where it feels like you got some sort of restrictions. I'm going to go in there and work on it. So let's debunk some common myths, and then we'll end. Myth number one is massage therapy is basically the best part of PT without all the PT. No, massage therapy has its own philosophy, purpose, and techniques. Physical therapy's manual therapy, like we talked about, has an intent, and that intent is to improve range of motion. So while massage therapy may make you feel better, it has its own purpose, and its purpose is often not driven to improve your range of motion. It may be to improve relaxation and circulation and to reduce pain, but it's not going to be the same technique that physical therapy is going to use to try and go in there and target trigger points aggressively to improve your range of motion and strength. Myth number 2, which is kind of the opposite here, is that physical therapists don't do any hands-on work. And like I said earlier, some physical therapists do take this approach where they said, I'm not doing any manual therapy, end of discussion. One, because they either don't believe in it, or two, because they've been doing this for a while and they've realized that it's kind of leading to the deterioration of their own health, and their hands have become arthritic, or they have carpal tunnel, or they have something else going on. So yes, PTs do hands-on work, but some PTs just decide they're not going to do manual because of whatever reason is that they choose to give. Now, when you're deciding which one you want to see, like I said earlier, the question that you really got to ask yourself is, am I dealing with functional limitations, pain, an injury? Because if you are, that's going to be more physical therapy's realm. Or are you dealing with just general sensation of tightness and discomfort? That would probably push me more towards be thinking, all right, maybe massage therapy. If it's a brand new issue, of course, you're going to want to go and see physical therapy, because the earlier that physical therapy can catch something, the better off the outcomes usually are. And then really the big question that you could ask yourself here is, do I want someone to treat me passively, as in I don't have to do anything, or do I want to be active and be doing exercises and stretches and try to get stronger and improve my range of motion and get back to doing what I love? And that's kind of the big question that I wish people asked themselves when they came into a physical therapy clinic. Because some people that come in and think they're just going to get, quote, the massage, what they're really saying is, I don't want to do anything, and I want you just to make me feel better. Right? In my mind, if you're not coming in with the understanding that you're going to be doing some sort of exercise, some sort of stretching, and you're going to be sweating, maybe massage therapy is more what you should be checking out. If you come in and say, hey, I know that I have these limitations, I know that I have pain, I want to get back to doing these things, and I'm willing to do the stretching and the exercises to get there, that to me sounds much more like, okay, you're ready and you're locked in. You got the the mindset for physical therapy. So, as per several of these podcasts now, this is another one of those situations where when they're utilized together, there is a beautiful synergy for both. The physical therapist working with a massage therapist can definitely improve outcomes for patients. And there's almost I've never seen a rivalry between a physical therapist and a massage therapist. Instead, I've only ever seen patients do better when they have both, because it improves their relaxation, their recovery, their active range of motion, their sensation of pain. It reduces that, and they typically get the best care from both, right? It's almost never, I've never heard of actually rather a massage therapist saying don't go to PT, and I'm not sure I've ever heard of a physical therapist telling a patient not to go to massage therapy. So this is one of those ones where I think, again, that beautiful synergy kicks in, and the patient only does better for doing both. But of course, you should always talk to your doctor about that, your primary care provider. So one of those instances where I usually see them, again, working really, really well together with very little animosity. But you let me know in the comments if you've seen any sort of rivalry or disagreements, or let's even say you know something about the lobbying groups between massage therapy and physical therapy, because I guarantee you there's probably been something there going on, just like with the chiropractors, right? Maybe there's something going on between the lobbying groups between physical therapy and massage therapy. But from my experience, it's, again, one of those beautiful synergistic things that just helps patients get better so much quicker. So this has been Dr. H, and this has been the world's okayest physical therapy podcast. Again, please don't forget to like, comment, subscribe, drop a review, share it to a friend or your grandma or your grandpa who's out there trying to figure out who they should be seeing and when. And everybody, as always, stay fit, stay healthy, and stay awesome. And I will catch you guys all in the next episode.